Thank you, Senator Moody. Senator Kim.
Thank you, Chairman. Thank you to the four of you for coming on out here. Ms. Barkoff, I'd like to bring you in on this conversation, just given your background here. In your testimony, you stated home and community-based services include a wide range of care and support that neither private health insurance nor Medicare even cover. Medicaid funding allows for services to exist and ensure people can comfortably age in place. Yet, there are lots of concerns about Medicaid cuts, and I guess I wanted your thoughts on this. Could you share how cuts to Medicaid can lead to devastating impacts for home and community-based services, and what consequences this would have on programs that serve older adults and people with disabilities?
Thank you, Senator Kim, for that question. And as you mentioned, the primary funder and the way we are able to help keep the majority of older adults and people with disabilities in their own homes is through the Medicaid-funded Home and Community-Based Services Program. States must have balanced budgets, and we have seen historically that despite the huge demand for more home and community-based services, that when budgets are reduced, states, the first thing to go are optional services. As my colleague, Mr. Resendez, spoke about, the fact that institutional care must be provided to anyone who meets that level, but if you want to choose to get in-home care, you have to sit on a waiting list. What we saw, actually, I conducted a study with other researchers about what states did during the Great Recession when we saw cuts, and every single state cut home and community-based services around the 2010 to 2013 timeframe, despite wanting to be able to serve more people. So as states are beginning to look at their state Medicaid budgets, implement new laws, it's very, very important for the aging and disability communities to make sure people understand it is a penny wise and a pound foolish to make those kind of cuts.
And as we're thinking about strengthening the home and community-based services, we also need to be addressing the workforce shortages that limit access to those services. So the Administration for Community Living, ACL, is a critical component of achieving that, which is why it's so critical that it stays intact. So from your experience, Ms. Barkoff, with ACL, could you share what federal strategies would be most effective to support recruitment, training, and retention in the direct care workforce?
I was very proud that during the time that I was leading ACL, we really heard from stakeholders about the importance of strengthening the direct care workforce and launched the Direct Care Workforce Strategy Center. It's very critical to work directly with states on how we can improve these jobs. We need to have better pay. We need better opportunities to advance in these careers, and we really need to bring respect to these jobs. It's critical that as states are implementing these new rules, we are already starting to see cuts in rates to providers, which translates to even lower rates to direct support professionals and direct care workers. And if someone can get paid more working at Target or at McDonald's than doing this incredibly important but not well-paid work, the shortages that we have will be so much worse.
Yeah. Ms. Ladau, I wanted to just bring you in on this as well. You shared, you said, quote, without access to HCBS and without efforts to prioritize housing and communities that work for everyone, people with disabilities and older adults will all too easily be pushed out of their homes. But you also shared the risk you are taking as well by not applying for Medicaid due to asset limits being so restrictive. I guess I want to ask you, how should Congress address the reality that even with HCBS, many people with disabilities cannot benefit from these programs because of a lack of readily accessible housing and the financial reality that qualifying for HCBS makes it difficult to rent or buy a home?
Thank you so much for this question, Senator Kim. And as a newer resident of your state who is currently in the process of searching for a home, I really do appreciate the opportunity to talk about this, because people with disabilities are so often trapped in this catch-22 of wanting to be able to live at home and thrive in their communities, but then facing the significant red tape that comes with getting the supports and services that they need. And so for me, I faced the quite frankly impossible choice of, do I stay on these life-sustaining Medicaid services, or do I recognize that the asset cap is holding me back and take a flying leap, quite frankly, to leave this program? It is an unfair choice that no one should have to face. And I really want to name that this is not a choice that anyone should have to make. But the answer is not to cut funding for HCBS. It's actually to make economically savvy policy choices that would, first of all, focus on incentivizing accessible housing stock and raising the asset limit for Medicaid. So right now, the asset limit, which I mentioned in my testimony, is $2,000. That hasn't been adjusted for inflation. That hasn't been adjusted since before I was born. Yeah. So when you think about that, I mean, that alone is reason enough to deter people from wanting to pursue a career, to pursue finding a house, because they're stuck by this asset limit. And the other thing I want to name is, I did a little research and double checked, and there's a study from 2023, the Kaiser Family Foundation found that the cost of long-term institutionalized care was around $11,000 more expensive than HCBS for Medicaid beneficiaries. So ensuring policies that complement rather than contradict each other just makes good financial sense.
Yeah. Well, thank you. With that, I'll yield back, Chairman.